Now, from Wall Street to State Street, the final word on today's numbers and all the day's business news. This is New England Business Day.
Necessity may be the mother of invention, but you need some smart people with a good idea in the mix, too. You'll find those people at the MIT 100K Entrepreneurship Competition. This evening, one of the top winners, Robopsy. Two members of Team Robopsy, Connor Walsh and Nevan Hanumara. Thanks for coming by.
Hello.
You've made something called a remote telerobotic needle insertion system. I'll let you explain what that is. Nevan, do you want to start?
Sure. So the project began 2.5 years ago as a collaboration between the Massachusetts General Hospital's Radiology Department and the MIT's Precision Engineering Research Group. Our doctor there felt that the current chest biopsy procedure could be improved, and we were brought together by CIMMIT, the Center for Integration of Medicine and Innovative Technology.
All right, and what am I looking at here, Connor?
So you can play around. This is sort of part of our system. Our system consists of two parts. One part that rests on the patient, which is this part here, and another box that's kind of like a PC that sits on a cart next to the patient. So this device here, and Nevan can maybe demonstrate it if we hold it.
All right, sure. And there's a needle involved here. Management does not allow me to have sharp objects, so we'll let you handle that.
Well, how the device works, basically the device is placed on the patient.
Okay.
Nevan,
So it travels with the patient into the CT scanner. So we've essentially given the doctor a pair of hands that can operate right in the CT beam. Then the doctor sits inside the control room and drives the device remotely. The needle is placed in the device, on the patient, inside the CT. Doctor leaves. The device grabs the needle, which I'm trying to demo here, orients it in 2 angles, and inserts it completely remotely.
And taking the biopsy, that case. So the application here is in cancer diagnosis.
So what we're focusing on at the moment is the lung biopsy procedure, and we're working with doctors to try and make this better. So at the moment for doctors, it's difficult for them to target lesions that are less than 10 millimeters in size, which is about the size of a grape.
Now, what was the reaction of doctors when you showed them what you had come up with? What did they say?
So sort of what we've seen so far is that they're very excited to try this. They believe it solves a real clinical need and that it can really have great benefit for patients, reducing the complications with the procedure and also reducing the radiation dose for the procedure.
Now, medical devices require FDA approval. Have you applied for such approval for this device, or where do we stand with that?
So we've currently sort of identified a number of key milestones that we're working on. So they include refining the design of the device to build another prototype, and then we're going to go into sort of animal trials, which we already have approval for. And after that, we'll submit for a 510K FDA.
How large is the need for this product? How many patients are we potentially talking about? And then the companion question to that is, that would suggest that there is a profitable market for this.
Yes.
Nevan, go ahead.
So we're looking at, I believe the estimate is 125,000 lung biopsy procedures per year.
Just in the U.S.?
Just in the United States. And there are other procedures that we're looking into adapting our product for. But we're focusing on this because we feel the need is greatest.
And as things stand now, if a doctor needs to perform one of these, it can't be done inside the CT scanner, which is the additional critical element
That's
to
the
what
crux
you've
of the
done
matter.
here.
It's done manually, which limits the precision.
And the reason that's important is that scanner allows very specific targeting, right?
Basically, the scanner gives you sub-millimeter accuracy for lesions, so you can like easily locate any lesion inside the body, but the difficulty is accurately targeting.
Next step, what do you do?
So we're sort of looking forward. We want to incorporate in the next while, and we've been very excited to work with sort of the MIT 100K competition and working with people in the Sloan Business School there and sort of refining our ideas, and then we hope to move forward and start a company.
A couple of the top performers in the MIT 100K competition. It's called Robopsy. Connor Walsh, Nevan Hanumara. Thanks very much for joining us.
Thanks a lot,
Thank you. It's a pleasure.
We'll see you.